Well, good morning, everyone, and thank you for joining us for our regularly scheduled briefing. I'm joined by Dr. Morrison, of course, and Chief of Nursing, Marion Dowling. Dr. Morrison and Marion will be providing an update about many things today, including long-term care restrictions, our COVID-19 vaccination program, and a detailed update on the moving forward reopening plan. First, I would like to acknowledge that as of today, we have no active cases of COVID in our province. That is a milestone that we haven't achieved in almost 8 months. Not only is that a testament to our controls and measures that we have put in place here in Prince Edward Island, but it also speaks to the high level of adherence we have to these measures, and that the epidemiology across the country is heading in the right direction, with case counts decreasing by over 70% in the last 3 weeks. Last week, following a conversation I had with Prime Minister Trudeau, we received confirmation that Prince Edward Island will be receiving over an additional 29,000 doses of vaccine before the end of June. And just yesterday, we got confirmation of an additional 6,000 vaccines will be added into the 2 shipments before the end of June. That means that in the month of June, we will be receiving 66,000 doses of mRNA vaccine in this province. This is welcome news for Islanders. Vaccines are key to our reopening plan, as we need to ensure Islanders are protected as we methodically reopen our borders and welcome our friends and family members back home. With the news of additional vaccines arriving before the end of the month, it has provided an opportunity with us to revisit our moving forward reopening plan. Our plan, as we discussed here on May the 27th, was created in a way that we could adjust our steps should factors change, and some of those factors have changed. And it's safe to say with these additional doses arriving, things are moving in the right direction and give us confidence to make some changes. Today, we will be announcing a soft launch to welcome Atlantic Canadians back to Prince Edward Island on June the 23rd. This will allow anyone that applies and is approved under our current streams of travel to be admitted between June 23rd and 27th without self-isolation if they have received 1 dose of vaccine. The reopening of our island borders to seamless travel for Atlantic on June 23rd will include permanent residents from the Magdalene Islands as well. There, over 80% of residents are vaccinated with 1 dose, and over 30% are fully vaccinated. Residents from the Magdalene Islands will require a negative test up to 72 hours prior to arrival in Prince Edward Island. And to make sure we are open fully to that market, tourism P.E.I. officials will unveil a targeted campaign for that region in the coming days. In addition, we will be opening our borders to the rest of Canada on July the 28th with a single point of registration called the P.E.I. Pass. The P.E.I. Pass will provide a seamless application process for anyone wishing to visit Prince Edward Island without having to fit into one of our current streams of travel. Individuals who have 2 vaccines will be exempt from isolation requirements, and those with 1 dose will have a modified isolation. Dr. Morrison will share a little more of this in a few moments. Key to all of this, as we said, has been the fact that we need to keep rolling up our sleeves and getting Islanders vaccinated. As of today, we are over 71%, I believe, Dr. Morrison, with residents with at least 1 dose. That rate needs to continue, and our news of increased procurement will help us move forward with our goal to get as many Islanders fully vaccinated as soon as possible, with that goal of getting 50% with 2 vaccines by the end of July 28th. And should we get there sooner, we would then be able to revisit a decision to open our borders a little bit sooner as well, but only when it is safe to do so. Last week and over the weekend, I spoke with my fellow Atlantic premiers about potential alignment for our reopening dates. I know this is something that worked well last year, and we were trying really hard to have something similar this year. But as of today, we just weren't able to find that alignment. However, we are able to make the necessary adjustments in our plan to allow for the seamless application and entry into Prince Edward Island for Atlantic Canadians on June 23rd, and I think it will be similar in other Atlantic provinces. Our decisions to get to today have been consistent with our planning throughout the pandemic. We are finding balance between keeping our province safe while making the cautious steps back to normal. As I said earlier, Dr. Morrison will discuss our new P.E.I. pass for Islanders and visitors to apply to come to Prince Edward Island. This pass will see us collapsing the streams of travel into a single application and allow anyone who wishes to come to Prince Edward Island, when the time is right, to apply, to supply a proof of vaccination, and then make your plans to come back. And we will be very excited to welcome you back here. I know there is a sense of urgency for some to go faster. And I appreciate that, and I understand why some people want that to happen. But we continue to need to be cautious for a reason, and this isn't over. The vaccine is a huge, huge help and will help us get to where we need to go, but it isn't a definitive, hey, this pandemic thing is over moment. It will help reduce the chances of spread and to help reduce people getting really, really sick or worse. But we only have to look north to our dear friends in the Yukon who are experiencing an outbreak with over 20 cases and a death in their population, while having over 70% of their population vaccinated with 2 doses. I did send along today my sympathy and best wishes to Premier Sandy Silver, and for him to pass that on to all residents of the Yukon as they deal with this difficult time. And I'm saddened by this news, and we need to use this as a moment for us to remember why we need to be cautious. While caution is our best friend at this moment, we are getting there. We are making steps. We're going as fast as we can safely do so, and that will be our process until we can safely say we're through this. So with that, Dr. Morrison, I will pass it on to you.
Great. Thank you. And good morning. And thank you for taking the time today to, on this beautiful June, well, it may not be beautiful out there today, but on this June morning. And as always, I'm grateful to be here in P.E.I. Today we'll talk a little bit about the COVID-19 situation, the vaccine rollout, some long-term care and community care visitation, as well as the reopening plan. As the Premier mentioned, there are no new cases to report today, and that there are no active cases. And we've had a total of 206 cases since the pandemic began. There continues to be good news regarding COVID-19 in Canada. Overall, cases are down 33% in the past week. And right now we have the lowest daily average in the country since late September 2020. The decline in cases in Canada in the past 3 weeks has been remarkable and more significant than we anticipated, signaling we are coming out of the 3rd wave and that public health measures and vaccines are working. The number of new cases per week is down 70% in the past 3 weeks and 83% from the peak of the 3rd wave. The number of active cases is the lowest it has been since early October across the country, and hospitalizations and ICU admissions are declining. The number of new cases has dropped more quickly than expected and faster than the national modeling projections. In Atlantic Canada, currently there are 258 active cases. In the past week, there were 135 new cases reported in the region. As a country and a region, we continue to be heading in the right direction. In P.E.I. to date, we have been spared a large surge in cases, and instead of distinct pandemic phases, we've experienced a slow burn or steady wave of cases with occasional outbreaks. And this has been the best possible scenario, and it has helped to protect our healthcare system from being overwhelmed. Island children have benefited from a full year of in-class learning, and we may be unique in Canada in this regard. The fact that schools were closed across the board for only 3 days due to COVID-19 is a tremendous achievement and one that every island resident should be proud of. By working together, focused on keeping COVID-19 out and containing the spread of the virus when we had outbreaks, we kept disease levels low in our province. And this is what has allowed our children, staff, and teachers to remain in the classroom throughout the school year. We know that at a population level, immunization is our best protection against COVID-19. As of the weekend, June 12th, a total of 116,691 doses of vaccine were administered, including over 17,000 second doses. So as the Premier mentioned, over 71% of eligible population has received at least 1 dose of COVID-19 vaccine, and over 12% have received 2 doses. Based on scheduled appointments, we do need an additional just over 13,000 people to receive a first dose before the end of June to hit our goal of 80% uptake of first doses by the end of the month. There will be sufficient vaccine now to allow us to meet this ambitious target. Anyone aged 12 and up who has not yet scheduled an appointment for their first dose should do so online for one of the health P.E.I. clinics. And in addition, individuals age 18 and over can book a first appointment online at one of the partner pharmacies. My understanding is also that the pharmacies will be expanding in terms of the number who will be providing vaccine as well. Now it's everyone's turn to get immunized, so please do your part and book your appointment. Public health nursing staff continue to vaccinate youth aged 12 to 15 in junior high schools across the province based on parental consent. As of late last week, over 1,400 doses of vaccine were administered, and this program will continue until June 22nd. This week, the Tourism Industry Association of P.E.I. will be launching a contest for vaccinated island residents to win a prize. I don't know what that is. Stay tuned for more details on this exciting campaign. And thank you to our partners in tourism for their support and creativity in encouraging island residents to be immunized. The goal of our vaccine program is to immunize all eligible island residents aged 12 and over with 2 doses over the summer. And 2 doses are important and better protection from COVID-19, especially against the variants of concern. Individuals who receive 2 doses of vaccine have a lower risk of spreading the virus to others and are less likely to become seriously ill from the virus. And I know there are infectious disease experts across the country that are telling us that 2 doses of vaccine is our best protection against COVID-19, especially the variants of concern, including the Delta variant. In terms of second doses, P.E.I. recommends that people wait 8 weeks between doses, regardless of the type of vaccine received. If you've received a first dose at a health P.E.I. clinic or pharmacy, you do not need to do anything to book your second appointment, as you will be contacted with an appointment. Everyone who received their first dose prior to the beginning of May at the public clinic have already been notified about their second dose appointment. And Marion may speak to this as well. Those who were vaccinated in May and June will receive confirmation of their second dose in the next several days and weeks. Anyone who is vaccinated at a pharmacy will be contacted by the pharmacy regarding their second dose. If you are moving to P.E.I. as a seasonal or permanent resident and need to get a second dose, please bring your vaccine record with you to the province so the appropriate vaccine and dose spacing can be arranged. If you are a P.E.I. resident and have had 1 or both doses of COVID-19 vaccine in another jurisdiction, you should arrange to have your vaccine record added to the provincial immunization registry. A form will be available online in the next couple of weeks for electronic submission, or you can bring your record to the local public health office. Long-term care and community care guidance will ease as we transition through the steps in the reopening plan. When we enter Step 2 on June 27th, designated visitors will increase from 6 to 10. Residents may visit community services such as a hair salon, provided they wear a mask, and vaccinated partners in care or designated visitors may visit with vaccinated residents outdoors without having to wear masks. In Step 3, projected to be July 18th, there will be no limit on the number of designated visitors. Residents may visit public places, such as a restaurant, following public health measures. Vaccinated partners in care and designated visitors may visit lived one in the residence room without having to wear masks, but masks will still be required in common areas. Further easing of measures over the summer will be announced as we go through the next few weeks. The moving forward plan, as the Premier mentioned, has been based on meeting certain vaccine targets, but also low levels of COVID and controlled transmission in P.E.I. and elsewhere in the country. As was mentioned a few minutes ago, we are on track to achieve the goal of immunizing 80% of eligible residents aged 12 and over with 1 dose by the end of June. I have good news for people currently in self-isolation. Effective on June the 17th, the self-isolation period will be reduced from 14 days to 8 days for people who travel to P.E.I. from within Canada, subject to a negative test on day 8. In our reopening plan, we projected to move to shortened isolation on June 27th, and now this date is being advanced to June the 17th. This means that domestic travelers who have completed at least 8 days of self-isolation on June 17th will be tested and subject to a negative test will be finished their self-isolation. As we are getting ready to reopen to travel, first within Atlantic Canada and also to align as much as we can with our Atlantic partners, as Premier King announced, effective June 23rd, vaccinated individuals approved under the Family Connection stream of travel, compassionate and exceptional travel, and seasonal residents from within Atlantic provinces will be able to submit their vaccine record, and subject to approval, they will not have to isolate upon arrival in P.E.I. They will be required to have a negative test soon after they arrive in the province. Any vaccinated residents in these travel streams from within the Atlantic provinces who've already had pre-travel approval for after June 22nd should contact Public Safety to submit their vaccine records. Beginning on June 27th, partially or fully vaccinated individuals traveling to P.E.I. from within Atlantic Canada will not have to isolate, subject to testing as directed at the points of entry. There will be no travel streams for travelers from the Atlantic Canada area after that date. Vaccinated island residents will be able to travel within Atlantic provinces and not have to self-isolate when they return home, subject to testing. Unvaccinated visitors from within Atlantic Canada will be required to isolate for 8 days with tests on arrival and day 8. The same is true for unvaccinated islanders who travel within Atlantic Canada. They will also be required to isolate for 8 days when they return to P.E.I. And of course, this is not forever. This is only until we feel like we've been able to achieve a good level of herd protection among P.E.I. residents. We will see more recreational travel for island residents within Atlantic Canada beginning June 27th. As the Premier mentioned, P.E.I. and the Magdalen Islands have agreed that permanent residents from the Magdalen Islands will be able to travel to P.E.I. subject to the same measures as others from Atlantic Canada. Conversely, vaccinated island residents will be able to travel to the Magdalen Islands and not have to self-isolate when they return home, subject to testing. As of Thursday, again on June 17th, vaccinated island residents and people from within Atlantic Canada who plan to travel to P.E.I. this summer can apply for a P.E.I. pass. The P.E.I. pass is a document that verifies if you've been fully or partially vaccinated and that you are not required to self-isolate in P.E.I. if you arrive from within Atlantic Canada, provided you meet these conditions. The P.E.I. pass can be used multiple times and will expedite screening at the points of entry. If you meet the conditions, no further registration or declaration is needed. The pass is good to enter P.E.I. and is not valid for traveling to other provinces. Each vaccinated person aged 12 and over can apply for a P.E.I. pass to be exempt from isolation in P.E.I. following travel within Atlantic Canada. Parents must complete the P.E.I. pass application for children under the age of 18. In order to apply for a pass, you need proof of residency and a copy of your vaccine record. And a vaccine record is an official document issued by a government, health authority, or licensed provider. It would contain at minimum the name of the person vaccinated, the date they were immunized, and the type of vaccine received. I know Marion will speak about the options to access vaccine records for people who are living here in P.E.I. In order to be eligible for a P.E.I. pass, you need to have received your first dose of vaccine at least 21 days ago. However, until July 31st, youth aged 12 to 15 will be considered vaccinated as soon as they get their first dose, because they really were only able to start getting their vaccine later on in this month. It is important that you apply for your P.E.I. pass 1 to 2 weeks before you plan to travel to P.E.I. If you live in P.E.I. and have had at least 1 dose of vaccine and plan to travel within Atlantic Canada, apply for a P.E.I. pass. If you are vaccinated with at least 1 dose and live in another Atlantic province and plan to come to P.E.I. this summer, apply for a P.E.I. pass. If you have a P.E.I. pass, you must have it with you when you travel to P.E.I. You will be asked for government-issued identification at the points of entry and may also you will undergo screening. If you arrive in P.E.I. before your P.E.I. pass application is approved, you can expect delays at the points of entry. For non-P.E.I. residents, if you are vaccinated and choose to not apply for a P.E.I. pass, you may be required to isolate or denied entry. The P.E.I. pass application will be available on Thursday, June 17th. We are concerned about a high volume of applications in the first few days, and I ask that if you are not planning to travel to or from P.E.I. before Canada Day, to please wait a few days to apply. Our partners in Justice and Public Safety will be working diligently to process applications as quickly as possible. Please be patient, especially in these first few days. Rotational workers and truck drivers who have registered their vaccine status with our office will automatically receive a P.E.I. pass for travel within Atlantic Canada. Rotational workers and truck drivers who have not registered their vaccine status with our office will continue with their current measures and testing regimen. There will be more information about the P.E.I. pass, including a series of questions and answers on the website by Thursday. For island residents and individuals who live in other Atlantic provinces who are not vaccinated, they will be required to complete a declaration and isolate for 8 days in P.E.I. A key element of the moving forward plan is testing at the points of entry. Currently, testing is available at the Charlottetown Airport and the Wood Islands Ferry. The testing site on Dickey Road in Borden is available 24 hours a day for workers. Work is underway to establish a large 18-lane testing and screening site in Borden that will be operational on June the 27th. The following guidelines will determine who is tested at the points of entry. 2 people per vehicle will be tested, preferably 2 adults. Youth under the age of 16 will not be tested at the points of entry. And if an adult is traveling with children, the adult and 1 child over the age of 16 will be tested. If the children are under the age of 16, only the adult will be tested. Children who are traveling to P.E.I. and attending camps and day programs will require a negative test prior to joining the camp. I ask camp operators to please review the new camp and day program guidance carefully. Testing at the points of entry will remain an essential part of our provincial response throughout the summer. However, our testing strategy and priorities may evolve and change as we transition through the moving forward plan. Changes to our testing strategy will be based on a risk assessment. Like immunizations, testing is another layer of protection against COVID-19. 2 changes which were announced in the last week. Effective July 18th, wedding dances will be permitted in cohorts. Dancing in all other settings and venues will resume when 80% of eligible island residents have been immunized with 2 doses of vaccine. And effective immediately, when necessary, individuals who have to travel out of province for medical care may be eligible for a self-isolation exemption, even if they have to stay overnight. And the camp and day program guidance should also be up on the website by tomorrow. The guidance on co-parenting, out-of-province parenting will be updated this week. To clarify, there will be no restrictions on the activities of children whose parents live in different provinces, but there will continue to be testing requirements. COVID-19 has been challenging for everyone. As much as we looked forward with anticipation to the time when public health measures would ease, when we could travel more freely, and when we could reconnect with family and friends in other parts of Canada and elsewhere. Now that time is finally here, and we are still learning. This phase presents new challenges. Like everything else with COVID-19, moving through the steps in the reopening plan is about balance. Throughout the pandemic, we have taken measured and careful steps, balancing risk with the need to minimize societal and economic disruption. We've acted quickly and decisively when necessary to limit community spread and when there have been outbreaks. Protection of the health of island residents has always been our top priority. The approach that has got us this far will be the same approach that we use to transition us out of this global pandemic. Over the summer, if we have outbreaks of COVID-19, we will act quickly. The risk of serious illness decreases as more and more people are vaccinated with 2 doses. We will continue to make decisions based on protecting the health of the public. I heard someone recently describe our collective experience with the pandemic as everyone has been in the same storm, only in different boats. There were times when it felt like we were in a well-built icebreaker, and other times where we felt like we were in a dinghy in rough seas. So now is the time to take the boat to shore. As a province, we are well positioned to enter the next phase of the Moving Forward plan. As we continue to navigate this pandemic and get to shore and get anchored, let us remind ourselves that we are getting through this together. In closing, let us continue to be patient and kind. Thank you.
Hi, everyone. It's good to be here to talk a little bit about our COVID response and the excellent work we're all doing together to get closer to our vaccination goals. The vaccine clinics continue to be booked with Islanders who are supporting these public health goals by getting their vaccine. From now until June 30th, there are already more than 24,000 scheduled vaccine appointments in our community clinics, and this is in addition to what will be available in our partner pharmacies. We will continue to add appointments to the vaccine clinic online booking system for those first dose appointments to provide additional access for Islanders to get vaccinated. We've had a significant number of people trying to book a second dose appointment on our online system, and we're asking you to please not do this. Second doses are being booked based on the timing of your first dose and are booked in a way so that we ensure everyone who wants a first dose gets done by the end of this month if possible. You will be contacted for your second dose in the same way you were contacted for your first dose appointment. And so if you have not yet booked your first dose appointment, there is still time. People can book directly online using our booking system at princeedwardisland.ca/getthevaccine, and that system is open 24 hours a day. Those who are not able to book online can call our phone line, which is 1-844-975-3303 to speak to a booking clerk. At this time, anyone who's had their first dose with our community clinics in March or April should have been contacted and booked for your second dose appointment. If you've received your first dose in March or April and have not received a notification of your second dose, please call our booking line to ensure your appointment is booked. We are currently booking second dose appointments and notifying people who received their first doses in May, and those individuals should have their appointments over the next couple of weeks or days. If you're unable to attend your appointment for any reason, or if you choose to get your vaccine at a pharmacy instead, please remember to reschedule using our online booking system or by calling the 1-844 number. As Dr. Morrison mentioned, our school vaccination clinics for 12 to 15-year-olds are going well. And in schools, we are only vaccinating students who have a parental consent and who agree themselves to be vaccinated. In P.E.I., people aged between 12 and 18 can book appointments for vaccine at our large community clinics, as they do have the right to receive health care on their own accord. We encourage all parents to discuss receiving these vaccines with your children. The proof of immunization is now available for those with a P.E.I. health card, and that can be accessed online at princeedwardisland.ca/COVID record. People can also receive a copy of their immunization record at the time of their second dose appointment or their first dose appointment in coming to our clinics. And as well, an online self-serve portal is expected to be available in the coming weeks. For those who are immunized at a partner pharmacy, they can request a copy of their record from that pharmacy. And all individuals who, even without a PEI health card, can receive their immunization record by calling our 1844 booking line. There's an option on that line for you to request a copy of your immunization record. As Dr. Morrison mentioned, with the increased calls for the PEI pass, we may also have an increased number of calls and requests for immunization records, and we will work our way through those as best we can, but ask people to please be patient in the coming days, and everyone's response, you will get a copy of your record if you're looking for it. I want to just offer my thanks to everyone who continues to contribute with us and the Chief Public Health Office and all Islanders to work together through this moving forward plan to get us out of this pandemic. Please remember to continue to follow the public health measures and guidelines in our hospitals and health centers when you come. They are still important until we reach these targets and continue to move forward. Thank you.
Thank you. We've had a number of questions just before we open it up for questions from the media. We've had questions about the swabbing that may happen at the points of entry. And some of us, so the Premier has volunteered to have his nose swabbed here. And so I'm inviting Jenny Green to come in and do the a swab. We've had people raise questions because some of many Islanders have had a deeper swab, so a mid-turbinate or a nasopharyngeal swab, which goes up much further. The tests that are going to be done at the points of entry are really the anterior nair, and so just at the front of the nose. So Jenny will start here, and.
Tickled more than anything, eh? Wow.
So it's a few seconds on each side, on each nair, and it's right at very anterior. Okay. And I can hear the Premier saying that it tickles.
It does tickle a little bit, yeah.
So,
okay, wow.
Yeah.
That's pretty simple.
Yeah. So, thank you very much.
Well, thank you, Jenny, yeah. Okay, well, that's,
so we just
didn't take very long at all. Okay. Okay.
So
All
I'll turn it
right.
over to
Okay, well, with that little sidebar, we will now turn it over to questions from our friends in the media, please.
Wayne Thibodeau, CBC.
Well, good afternoon, and yeah, you've thrown a lot at us here, so let's see if we can break this down a little bit. Maybe my first question is for Dr. Morrison. Dr. Morrison, a lot of dates there. I'm specifically interested in the June 23rd versus June 27th dates, what the difference is. So on this soft opening on June 23rd, can you tell me what the difference is between the 27th? On the 27th, can anybody in Atlantic Canada come to PEI, and can you just explain a little bit about what this PEI pass is actually going to look like?
Okay, so I think there's more. There's a number of questions that may be in there, Wayne, but I'll do my best. So the date of the 23rd is really, I think the Premier talked about it as almost a launch of the opening to the rest of Atlantic Canada for travel, and so right now, people from across the country, including Atlantic Canada, can come to PEI on streams of travel. So family, compassionate, exceptional circumstances, as well as work, of course. And so But starting on the 23rd, under those streams of travel, if you're vaccinated, you would not need to isolate at that point in time. And that's just giving us really a few days to make sure we can have everything in place so that on the 27th, that it would be open to people who are not in those streams of travel. So maybe, Wayne, you have a friend who wants to come from Halifax, and on the 27th, they would not have to isolate. If they have a P.E.I. pass and are vaccinated, they would not need to isolate. So it's really a bit of a stepping stone, I think, towards the 27th, So the next part of the question, I think, was around the P.E.I. pass, and it is for island residents and for those in Atlantic Canada to start with that are going to be traveling to P.E.I. or returning to P.E.I. that they will. Last year we had a declaration, and in many ways it's a declaration which includes your vaccine record, and that will mean that you'll be able to use it more than once. I think I mentioned once you have that, and it will mean that when you come back to P.E.I. and come through the border, that you will not be flagged for isolation, and you will not have to isolate when you're back in P.E.I. I don't know if you want to add anything to
I
that.
think that's the best way. I think last year we had the declaration form, which all provinces have, and I understand all provinces in Atlantic will have again this year. And that form, the P.E.I. pass, is the kind of the cute name that we've put on it, is simply that also will allow us to validate the vaccination record, which is important for us here for travel. So I suspect it will be a simple and seamless process, similar to last year, and it will just make it that much more efficient at our points of border entry for our screeners and testers.
And I'm not
My
sure.
second question actually is to the P.E.I. Premier, since you're right at the mic there. I'm sure you've heard P.E.I. Premier, as we have as well, from islanders who have loved ones in Ontario, from tourist operators here in Prince Edward Island who are struggling and continue to struggle. And yet we see New Brunswick opening July 1st. We are still 28 days later, even with this adjusted plan. Why couldn't the 3 maritime provinces, at least, or 4 Atlantic provinces, get on the same page? And why do we have to be 28 days later than New Brunswick? What is holding up the opening of the rest of Canada here on P.E.I.?
Well, I'm not sure anything is holding it up. I mean, we have been the most consistent province from the very beginning with this and how we've been dealing with the pandemic, measuring the caution needed with the reopening. We haven't been able to get to a regional alignment this year. I think obviously a couple of provinces feel more comfortable than we do to go faster. They would all acknowledge and have acknowledged to me, and their colleagues have acknowledged to Dr. Morrison, that going faster brings with it an increased level of risk, which they're comfortable to deal with. They feel they have a higher capacity to deal with an outbreak should it occur than we do. And it simply comes down to it that we're not comfortable from a health perspective to go that fast. We want to get there, and we will get there at or about the same time. We might be a couple of weeks delayed in terms of opening to the rest of Canada. But I would say, and I have said consistently to those in our tourism sector, 80% of our tourism dollars in P.E.I. on an annual basis come from Nova Scotia, New Brunswick, and Prince Edward Island. So we will be open to that market, which is our largest part of our market. As an overall province, without Cavendish Beach, which is normally the music festival, which is usually open, say, June 7th or that weekend or a little bit earlier, without that in place, July 15th is kind of the official open to the rest of Canada, in a normal year. So we might be a little bit delayed in getting to that. If we can get there earlier than the 28th, we will, if it's safe to do so. But I do feel comfortable that we will have a much greater tourism season than we did last year, and perhaps even far exceed what we were anticipating 6 or 8 weeks ago. But we make these decisions in knowing that there will be individual operators who have a bigger market outside of Atlantic and all of those things, and they will be impacted. And we're trying to work through with our programming to make that as least amount of impact as possible. But I feel from a perspective of our tourism sector that we will be in a much better shape than we were last year, and probably get more of our tourist year than we thought. And it just comes down to it that, Dr. Morrison and I talked this morning in my office, and Prince Edward Island really hasn't had a first wave or a second wave or a third wave. And it's because we have been, managing this cautiously and doing the things that need to be doing. Everyone in P.E.I., with the exception of a couple of days, have had in-school learning. I mean, we've done this very, very well. And the last thing we really want is a fourth wave and get open, and then in the middle of July have to slam this down. So look, we're understand that people want to do this faster. We understand some want to do it more slowly. We feel this is a balanced approach, and we're comfortable with where we're at. And I think we'll make a great tourist season out of this. And if we can get through this, keeping all islanders safe, then we will have succeeded.
Thank you both.
Thank you
both very much for your time.
Allison Jenkins, The Guardian.
Yes, hello. I just want to say thank you to Premier King for getting swabbed and tested there so we can all see the process. I had a question for Dr. Morrison about the day 8 testing. You can leave self-isolation on day 8 with a negative test. Just wondering the type of test, if it's going to be turned around that quickly on day 8. Similarly, people who are on day 8 of self-isolation, can you break that down a little bit for me?
Hi, Allison. So wherever possible, the ID Now tests, which are the molecular, more rapid tests, will also be able to be used, and that has already started. People who do need a test, so that should be a fairly quick turnaround for most, and it also then gives even more capacity to the lab to be doing a fast turnaround within the day of PCR-based tests if those are required. But they're looking at both options, but most people will have the results back on the same day that they get tested.
Okay. And my second question would be, so thank you for Premier King, but it leads to my question, is the testing a deterrent to visitors, knowing they will be swabbed kind of at the point of entry? Is there any rumblings about this that anyone's heard?
I just missed the first part of your question, Allison. Can you?
Well, I guess the question would be, is the testing at the points of entry, has that been a deterrent to visitors that you know of?
Yeah, well, I mean, obviously we haven't had any visitors really come outside of the streams of travel we've been having, but I mean, I think we've heard some people particularly in the tourism sector, suggest that it might be a deterrent. And I think, given what happened, for example, in Yukon, I think our plan is built upon trying to be as safe as possible and open as, and as open as possible at the same time. And we certainly feel that if we could, inconvenience somebody for 15 more seconds at the border to do what I just did here today. It's not a very invasive process. It tickles more than anything. But if we can identify some positive cases at that point, that it will have a much lesser impact to the overall health and well-being of our citizens, from a community perspective. So we're really trying to do this as a safety precaution, as an added precaution. As Dr. Morrison has said, that our limited capacity to deal with an outbreak is still a major concern here, and we feel like we're moving in the right direction. But having that added level of testing is important, and I don't think it is a deterrent. I think it could be turned around and used as a positive as well. I mean, we can't forget that we've been through 16 or 17 months of the most difficult times in the last 100 years. So we have some scars that are internal and external to show for that. And I think the number one factor that every tourist operator has been telling us that people are most concerned about is safety. So I see that as being an added precaution and a benefit to us to know that if you're coming here from Atlantic first and then the rest of the country, you're coming to what could be the most secure and safe location of all, and that could be a benefit. So, but I see the both sides of this. We've said from the very beginning, we don't want to be at our borders turning people away or making it inconvenient to get here. That's not how we're built. As soon as we can move away from that, we will. But until we can safely move away from that, we have to take these precautions. Islanders demand that we take them, and Dr. Morrison and I have followed this same process since the start, and we're not going to stop now.
Thank you very much.
Thank you.
Louise Martin, CBC.
Hello. Thank you both for taking our questions. I have about 200 of them. Just kidding. I guess this is not an official question, but will we know if the premier is negative or positive by the end of this question session?
That's a good question. We
kidding.
should know that. We should know that. That is actually.
We should. We
Yes.
should. All right. So these are significant changes in really, a short amount of time since the last briefing and since we spoke to Dr. Morrison last week. So I'd love to hear from both of you. Is this solely based on the number of vaccinations coming into the province and the hope that more Islanders will be able to get their full dose by summer? Because I'm just curious as to the need for this tourism prize that is a mystery at this point. Is there a sense that maybe we've stalled a little bit? I'm just curious as to that.
Hi, Louise. So I think what has really happened since the moving forward plan was being written and announced a few weeks ago was that not only have we secured more vaccine into the province, and we've talked about it before, we've had not great visibility to our shipments of Moderna. We had some projections, but they were never confirmed. So having our Moderna shipments confirmed and more than we expected before the end of the month has really been positive. But alongside that, we talked about it in the notes that the rate of disease and the infectious disease cases have decreased much more quickly than anticipated across the country. And that has also changed in the last 3 weeks. And so those things together, which are really key elements of us moving forward, have been what has led to some of these changes, that we are more comfortable going more quickly, which we said we would if we could have a chance to do so. So I think this is, as you mentioned, these are big changes, but I think they're made because we think we can still keep Islanders protected by making sure we have good vaccine uptake. At this point in time, the percentage of people in each sort of decade that are being vaccinated are all looking very good. I don't think it's been stalled at all. There continues to be great demand, and we'll continue that for first doses, and we anticipate that will continue and make sure people get both doses.
Yeah, and I think, Louise, just when you talk about the tourism prize, or you see a company like ADL doing what they can, I really think that's just everybody's desire to try to make sure they're doing as much as they can to get us through this. And I just see that as a good show of leadership and concern, quite frankly, amongst all Islanders, that we want everyone to get out and get vaccinated as soon as possible, and that will help us get back to normal. But I mean, I ask every day about our vaccination uptake, and I know Dr. Morrison, and she's indicated this, was totally relieved and happy to see, 35,000 more doses of vaccine come into this province by the end of June. That's a relief. And I think our pace of vaccine into the arm has been tied to the procurement of the vaccine nationally, and now this will continue. So I feel like we're on a good trajectory there. That we don't see much or any vaccination hesitancy here in PEI, thankfully, and we just need that to continue.
All right, so we don't need a lottery.
No.
Okay. My second question, Dr. Morrison, back to you. A lot of people have been asking about the 21 days after vaccination. Could you explain that a little bit more? Why the 21 days? I previously thought it was 2 weeks after vaccination for it to kind of kick in. The 21 days and who that applies to and how that will apply. I know you mentioned for those under the age of 12, for those 12 and up in that younger age because they're just getting their vaccines. I'll just let you explain it fully.
Okay, so certainly the studies that have come out primarily out of the UK but other international studies have looked at after one dose. It's really up to 21 days before you'll see the best effect after one dose of vaccine. Now, so that's why the 21 days is there, and it's based on the evidence that we have. Now, you'll often hear to be fully protected, it's 2 doses plus 14 days. And when they talk about breakthrough case definition or who is considered fully vaccinated, it's 2 doses plus 14 days. And again, that's to make sure that you see the maximum effect after 2 doses of vaccine. So that's why the 21 days. And now recognizing that 12 to 15-year-olds are just getting their appointments sometime near the end of June. And often young people do get COVID from parents. Usually it's transmitted that way. But that's why we have waived for the P.E.I. pass for Atlantic Canadians, travelers that are 12 to 15, as long as they've had their first dose, that 21-day period is really going to be exempted. And that's to do with some practical reasons for the first month, basically, that it's in place.
So just to be clear, for the P.E.I. pass, you have to have had your vaccine plus the 21 days in order to qualify for an exemption from isolation. I just want to be clear about that.
Yes, for Atlantic Canadians, yes, apart from the 12 to 15-year-olds. You're correct.
And then for the rest of Canada on July 28th, it is still the 21 days applies, right, since the date of your vaccination.
It'll be and I'm glad you clarified that. So the P.E.I. pass for all non-Atlantic Canadians will be to be fully vaccinated.
Okay, plus the 21 days, though, right?
No.
After the fully vaccination?
No, just two doses of vaccine.
2 doses. Okay. Thank you.
You're welcome.
Thank you.
Gabrielle Drumeau, Radio-Canada.
Good afternoon to you all. Ma question c'est en français pour la docteure Reda Morrison. Alors, docteur Morrison, les îles de la Madeleine les résidents des îles de la Madeleine pourront entrer à l'île à compter de la fin juin. Alors, moi, je voulais savoir comment allez-vous vous assurer qu'uniquement les résidents permanents des îles de la Madeleine vont pouvoir entrer ici dans la province et de ne pas laisser, par exemple, entrer les résidents du Québec continental et comment allez-vous faire votre communication avec les Québécois pour qu'ils comprennent bien les règles?
Alors, bonjour. Alors, c'est plusieurs choses. Les résidents des îles de la Madeleine doivent faire application pour le P.E.I. pass comme quelqu'un de Nouvelle-Écosse ou même les insulaires ici. Alors, ils doivent montrer qu'ils sont vaccinés et c'est vraiment comme une déclaration avec ça. Et puis, quand ils arrivent ici, s'ils restent à l'île du Prince-Édouard, ils vont être demander les questions, screener près de Surrey, et puis doit montrer qu'ils ont un test résultat qui soit négatif pour COVID-19. Alors, on vient de parler, je sais que le premier ministre a parlé je ne sais pas comment vous dire en français, le maire des îles de la Madeleine. Et puis moi, j'ai des communications avec Santé publique à Québec. Alors, je pense qu'ils vont avoir vraiment un programme touristique pour informer les résidents des îles de la Madeleine. Et puis, quand vous arrivez à l'île du Prince-Édouard, vous doit montrer l'identification et puis avec votre adresse, et puis ça va être aux îles de la Madeleine. Alors, c'est pas quelqu'un qui habite à Montréal qui vient arriver aux îles de les Madeleines. J'espère que ça répond un peu à votre question.
Oui, tout à fait, tout à fait. Et ma deuxième question, je sais que vous l'avez déjà répondu en anglais, mais j'aimerais l'avoir en français. Alors, c'est un gros changement dans le plan de déconfinement de l'île que vous annoncez aujourd'hui. Est-ce que vous pourriez m'expliquer en français pourquoi faire ces changements maintenant et quelles ont été les raisons, les motivations pour arriver à ce changement présentement que vous annoncez aujourd'hui?
Alors, vraiment deux raisons. On vient de confirmer plus de vaccins ici pour les insulaires, et on a plus de confiance vraiment avoir 80% des insulaires avoir au moins une dose de vaccination. Et puis, l'autre chose est qu'on voit 70% moins de cas dans les 3 dernières semaines de cas de COVID-19. Alors, c'est vraiment le nombre de cas qui diminue pas seulement dans la région, mais partout au Canada, et le nombre de vaccinations qu'on reçoit ici. Alors, c'est vraiment pour cette raison qu'on a hâte de changer et de faire un peu plus vite les changements ici pour l'île.
Ok, parfait. Merci beaucoup. Bonne journée.
Bonne journée.
Marion Orneau, La Voix.
Good afternoon. J'ai une question pour vous en français, docteur Edward Morrison. Je voulais savoir, l'ouverture des frontières le 23 juin est toujours associée à l'objectif de 80% des insulaires qui sont vaccinés, qui reçoivent au moins une dose. Est-ce que ça veut dire qu'il y a 13 000 personnes, 13 000 insulaires qui doivent être vaccinés dans les 8 prochains jours?
Bonjour, oui. Alors, oui, et on a dit vraiment que on utilise le 27 vraiment, mais c'est pas le 23 parce que, c'est à peu près 13 000 qui doivent être vaccinés avant le 27 juin. Et puis, avec le vaccin qui arrive, je pense qu'on peut en faire... et même avec le vaccin qu'on a cette semaine. Et puis, on regarde le nombre de personnes qui a déjà un temps pour en faire vacciner. Et puis, on a aussi en train de vacciner les jeunes entre 12 à 15 ans à l'école. Alors, je pense qu'on serait juste à peu près plus que 13 000 avant le 27.
Ok, merci beaucoup. Et ma deuxième question, est-ce que l'isolement réduit à 8 jours fonctionne aussi si on revient de l'étranger et qu'on fait étape à Montréal dans un hôtel de quarantaine fédérale?
À ce moment, c'est seulement pour les personnes qui voyagent domestiques, parce que les personnes qui retournent de voyager international, ils sont réglés par le gouvernement vraiment fédéral. Alors, à ce moment, c'est 14 jours pour eux. Et puis, si on va regarder qu'est-ce qui arrive là-bas et puis et on va faire les changements à un moment donné.
Ok. Merci beaucoup. Bon après-midi.
Okay. Merci.
Julien Lecacheur, Radio-Canada.
Good afternoon to everybody. Thank you so much, Premier King, for the swabbing. It's going to be a great footage for tonight, so I appreciate that. Dr. Morrison, I'm going to ask you a question in French for you. Dr. Morrison, je voudrais savoir comment vous... Est-ce que, je ne sais pas si c'est inquiétude, mais comment vous allez gérer le fait que des touristes venant de tout le Canada vont aller au Nouveau-Brunswick au mois de juillet, mais l'île du Prince-Édouard ne va pas les autoriser tout de suite. Néanmoins, les résidents du Nouveau-Brunswick qui pourront venir à l'île du Prince-Édouard seront en contact avec ces touristes du reste du Canada au Nouveau-Brunswick. Est-ce que ça vous inquiète d'avoir ce mélange de personnes qui pourraient ensuite venir à l'île du Prince-Édouard en juillet?
Merci pour la question parce que c'est une bonne question. Et puis, oui, ça m'inquiète un peu. Mais sauf que je sais que les personnes qui arrivent ici doivent être vaccinées, sinon ils vont isoler. Et l'autre chose qui me fait, on va faire les tests au point d'entrée. Alors, pour cette raison, ça m'inquiète un peu moins. Et je sais que si quelqu'un arrive même d'Ontario à Nouveau-Brunswick, il doit être là pour au moins 2 semaines avant qu'il peut arriver ici à l'île du Prince-Édouard. Alors, il ne saurait pas permettre d'entrer ici. Mais même les autres résidents de Nouveau-Brunswick, ils doivent être vaccinés, sinon isolés, et puis on va faire les tests. Alors, pour cette raison, c'est important qu'on peut faire ça parce que Nouveau-Brunswick serait ouvert un peu avant nous.
Dr. Morrison, oui, allez-y.
I might repeat that in English, if you don't mind, because I think it's a good question. The question was, am I worried about the fact that New Brunswick residents may be coming to P.E.I. when they open to the rest of the country, and they'll have a lot of people from around the country, and then they open up, and then we have New Brunswick residents coming here. And I said, yes, that worries me a little bit, but the things that make me feel a bit better are the fact that New Brunswick residents who are vaccinated, they'll need to show that they're vaccinated to come here without isolating, and those that aren't vaccinated will have to isolate for 8 days. And then the other thing that also will make me feel a bit better is that we'll be testing certainly quite a number of people in those first weeks. So I think that will help decrease that a little bit. And if someone from outside Atlantic Canada comes to New Brunswick, they will need to show that they've been there for 2 weeks prior to coming here.
Dr. Morrison, ma deuxième question pour vous va être à propos des tests qui vont être notamment réalisés au pont de la Confédération, de construire un grand site pour pouvoir tester le plus grand nombre de personnes. On a vu le Premier ministre montrer l'exemple avec ce swabbing du nez. Dr. Morrison, en gros, comment ça va fonctionner ces tests au pont? Est-ce qu'on fait le test, on prend les informations et ensuite eh bien, le touriste peut entrer dans la province? À quel moment, en fait, on donne les résultats? À quel moment on peut savoir si la personne est positive et négative et pouvoir ainsi l'isoler ou la renvoyer à l'extérieur de l'île du Prince-Édouard?
Alors, je sais qu'ils vont avoir plus d'informations. Je pense qu'ils vont faire vraiment une vidéo pour montrer tous les détails, mais les résultats, si c'est positif, si vous recevez un test au point d'entrée au pont, vous pouvez continuer et puis à peu près une demi-heure, 40 minutes après, vous êtes appelé pour dire que vous êtes positif. Et puis, et pour diriger, pour avoir un test, un autre test pour confirmer. Alors, c'est peut-être avant d'arriver à Charlottetown, si vous êtes en train de conduire de Borden à Charlottetown, avant d'arriver à Charlottetown, vous recevoir un appel pour dire vous êtes positif.
Je m'excuse de reprendre sur votre réponse, Dr Morrison, mais vous ne prenez pas un risque, là, de laisser rentrer quelqu'un positif et ensuite il pourrait très bien aller au magasin d'alcool de Borden-Carleton ou se promener dans le centre-ville de Summerside. Vous ne voulez pas faire attendre les gens 30 minutes sur le côté du pont pour recevoir le résultat du test?
Oui, c'est toujours une balance des risques et puis on peut pas avoir tout le monde stationné à côté du pont pendant demi-heure et puis on veut pas faire ça. Mais et puis je sais que même s'ils rentrent quelque part, il y a des autres mesures de santé publique. Ils vont avoir les masques, ils vont avoir laver les mains, toutes sortes de choses comme ça s'il doit entrer quelque part. Et puis alors, et puis on sait que la plupart des gens sont vaccinés. Alors, et puis les personnes qui sont pas vaccinées, ils vont directement, ils doivent isoler. Alors, ils n'ont pas le droit d'arrêter quelque part. Alors, c'est seulement les personnes qui sont vaccinées qui on laisse aller et puis on va les appeler s'ils soient positifs.
Merci beaucoup.
De rien.
Maude Montembeau, Radio-Canada.
That's it? Okay. All right. Well, Harry and Dr. Morrison, thank you very much. And to all Islanders, thank you for tuning in as always. And stay safe. Have a good day.